Good evening. So, our topic for today is all about cleanliness and hygiene. Hygiene is very important for us caregiver because we are the number one giver of care to our patient, and most of them it's about hygiene and grooming and cleanliness. So it's very important for our patient also for the following reason. First is you help to promote both physical and emotional health. So what are those physical and emotional health? Physical, because it will prevent the patient from having infection or acquiring infection because you're cleaning the patient, so you're preventing them from having infection. Then you are also promoting uh, good blood circulation to the patient because as you do hygienic care to your patient, you are exercising their body or body parts, so the uh, blood circulation will be okay. Then emotional, of course, anyone or whoever patient you're giving care or having hygienic care, of course, they will feel that they are valued. They will feel more well and clean if they are uh, provided by hygiene and grooming. So these are the benefits of personal hygiene. So first is let's start with oral hygiene. So oral hygiene, it includes care of your teeth, gums, tongue, lips, and soft parts of inside of the mouth such as cheeks and roof of the mouth. So what are the purposes of giving oral care? So first is we're preventing mouth odors and infections like those mouth odors, we are calling it as halitosis. Infections like fungal infections, or we have bacterial infections. If we are uh, forgetting to do oral care to our patients, of course, our patients will get infections. Then increases comfort. Okay, if you're giving a patient a oral care, of course, what he or she feel will be comfort. It will increase their comfort. Then make food taste better. Because if you have good oral care, okay, it will increase or it will enhance your appetite. So you will eat more or you will taste the food more. Then it will reduce risk of cavities like dental caries and periodontal diseases. So in our demonstration, we'll be doing both oral care for independent patient, those patients that they can do alone, and those patient who is dependent, those patient who are unconscious, bedridden, or those patient who cannot do it alone. So these are the things needed for the oral care. We have the toothbrush, we have the toothpaste, we have the mouthwash, we have the floss, water cup, straw, kidney basin, hand towel, paper towels, and gloves. So what are the things that we need to understand in giving oral care? The first thing that we need to take note is all about aspiration. Aspiration is breathing fluid, food, vomitus, or an object into the lungs. So kung ang pasyente mo ay unconscious, okay? So pwedeng pumunta yung tubig, yung pagkain sa baga niya instead sa tiyan niya kasi nga relax yung mga muscles niya. So dapat maingat ka sa pagbibigay ng oral care, especially sa unconscious patient para ma-prevent mo yung aspiration. Aspiration is different from choking. Choking is mayroong food na bumara dun sa daanan ng hangin. While aspiration, it can be food, it can be fluid, or it can be vomitus. So, that's the difference. So, paano mo mape-prevent yung aspiration na tinatawag? You should position the patient on side or side-lying position or lateral position. So, kung anything, kung meron siyang laway or anything is, or kung meron kang excess na tubig na hindi nakuha, magde-drain lang siya sa side. Then, use only a small amount of fluid to clean the mouth. Okay? Then, do not insert dentures. Okay? Dentures, pagka hospitalized ng patient, sa first admission pa lang, is tinatanggal na ang pustiso. Dahil pwede ring malunok ng pasyente ang pustiso. So, mamaya, mag-upload ako ng demo kung paano ka mag-oral care sa dependent and independent patient. So just watch it, guys. So next is denture care. So denture care, so ito yung mga pustiso, ito yung replacement ng natural teeth natin lost because of health condition or injury. So ito yung mga artificial teeth. So without this, the patient or our patient cannot eat well or wala silang appetite kasi wala nga silang panguya. Kaya we as caregivers, we should take care of their dentures. Okay, especially those patients who cannot clean their dentures alone. So later on, I will show you a video on how to do denture care. So purposes of denture care, it helps you to prevent conditions such as plaque. Okay, plaque is yun yung mga naiipon ng mga dumi sa dentures. So, ang dentures kasi replacement or yung artificial teeth. So, kung paano mo linisin yung normal teeth mo is ganun din maglinis sa dentures. So, these are the things that you need to do during denture care. So, later on, sa video, makikita nyo ang mga gagamitin natin sa denture care. So, let's proceed with hair care. So, hair care or hair shampooing, it is a cosmetic act of keeping hair clean by washing it with shampoo or other detergent products and water. Okay? Hair conditioner may also be used to improve hair texture and manageability. So, kung ang buhok ng patient mo is maraming tangles, matigas, or mahirap suklayin, dapat gamitan mo siya ng hair conditioner. Make sure lang na ang patient mo wala siyang irritation or allergy sa mga products na to. So, anong mga purposes ng hair care natin? First, it will promote comfort to our patient. So, tayo, of course, pag naliligo tayo, feel natin fresh tayo. So, ganun din ang ating mga pasyente. Next is to remove tangles from the hair, because you're putting a conditioner, so you can remove the tangles. To preserve or keep the hair in good condition during illness. To observe presence of lice without being aware of it. Some of the patients, especially those patients who are long-staying patients, okay? So, hindi nila nararamdaman, meron na pala silang infestations and infections sa hair nila. So, we can know or we can assess kung meron na ba sila if we're doing hair care. Because we're not only doing hair care, but we are also assessing kung anong meron, may problema ba sa buhok si patient, may wounds pa doon or anything na meron. So we can report to our supervisor. Then, in preparation for diagnostic procedures involving the head, meron tayong mga procedures which require hair care bago gawin yung procedure na yon. For example, if we're doing sleep study, okay, to know anong mga ginagawa ni patient, anong brain activity ni patient during sleep, okay, ang gagawin niya ay kailangan, ni-require ng procedure na to na maligo muna yung patient para clear yung nasagap na waves ng patient, ng machine sa sleep study. So these are the things that we'll be needing in our hair care. So 2 bath towels, we have the washcloth, we have the shampoo, the conditioner, we have the bath thermometer, we have the pitcher, we have the shampoo tray, basin or pan, waterproof pad para hindi mabasa yung buong bed. We have the gloves and we have the comb and brush and we have the hair dryer. So later, I will upload yung kung paano gawin yung hair hair care. So let's proceed sa pinakamahabang step, which is the bathing. Okay, bathing cleans the skin. It also cleans the mucous membranes of the genitals and anal areas. Anong mga benefits ba ang nakukuha natin pag naliligo? First, it will help a person feel relaxed and refreshed. It will clean the skin and eliminates body odors. Okay? Then it will exercise your muscles that might otherwise not be used. So, ang patient mo bedridden and you're doing a full bed bath, of course, if you're touching any parts of the body, so of course you can exercise it as well. So, mas gumaganda yung blood flow or nai-stimulate yung blood flow sa skin ng patient. So it helps also the patient or resident meet the needs of love and belongingness and self-esteem. So kung ang patient mo walang dumadalaw na mga relatives, kung nakikita niya na siya ay pinapaliguan mo, pinibigyan mo ng oras, they will feel that they are belong, they are loved by the healthcare workers. Then it will give you an opportunity to observe for skin problems. So, pwedeng ma-assess mo yung skin niya kasi nga buong katawan is paliliguan mo. Pwede mong ma-assess kung may mga nag-i-start na ba diyang mga pressure ulcer or bed sores. So, may mga irritations na ba nag-i-start. So, ma-assess mo siya agad pag nag-bed bath ka. So, ano yung mga guidelines na pwede dapat nating sundin if we're giving bed bath? So first is follow the doctor's orders on the nursing care plan. So we should always follow the doctor's order. Okay? Kasi anything na may mangyari si patient, nahilo siya or whatever, if we don't have doctor's order, of course, ang sisisihin ay tayong mga caregiver. Then, before beginning the bath, explain to the person how the bathing procedure will be carried out. So to gain their cooperation, we should explain them fully what are we going to do. Collect all the necessary equipments. Make sure na kompleto lahat ng gamit niyo para hindi naka-gloves na kayo, tatakbo pa kayo dahil may nakalimutan kayo. So make sure that your things are complete. Then all doors and windows should be closed. So para hindi mag-hypothermia si patient, hindi lamigin, and it will also promote the privacy of our patient. Place a non-skid mat in the bathtub. If you're putting your patient in the bathtub, place a non-skid mat para hindi siya madulas. Or encourage the person to use handrails kung meron siyang weakness na part. Or for example, meron siyang stroke sa left side, so dapat merong mga handrails yun. So he or she can support himself. Then never lock the bathroom door. So kung nag-a-assist kayo ng patient, dinala niyo sa banyo, sabihin niyo sa kanya, it's not allowed to lock the door because anything that might happen to them, okay, so you are liable. So dapat mabilis kang maka-access. So dapat hindi lock yung door. Always check the temperature of the water kasi baka masyado ng malamig, mag-hypothermia na yung patient. So you should always check. The water temperature should be 40.5 degrees Celsius to 46.1 degrees Celsius. Then, or in Fahrenheit, it will be 105 to 115. When assisting a person to and from the tub room, always make sure that he or she is adequately covered. So for privacy purposes, always help the person into and out of the bathtub or shower. Follow standard precautions when bathing a person. Wash from cleanest to dirtiest. Always remember that we'll be doing any procedure, we should start from cleanest to dirtiest. For example, if we're cleaning our eyes, okay, this is our eyes. We are calling this as canthus, okay, canthus and then inner canthus and then this is outer. So if we're washing our eyes, we should start from inner to outer canthus because if we start from outer to inner canthus, okay, merong butas dito sa inner canthus, any dust na meron dito, mapupunta sa loob dito. So, pwede magkaroon ka ng infection dito kasi merong butas dito. So, we should always follow from cleanest to dirtiest. For example, We should always clean our face first before our perineal area or our genitalia because the cleanest is our face compared to our genitalia. Never nating gagawin na unahin mo munang linisin ang genitalia mo bago ang face mo. So, kadiri naman yon. So, always wash from cleanest to dirtiest. Then we touch the person's body gently yet deliberately using a long, firm strokes. Okay, we should always follow a long, firm strokes. Why? To promote a good blood circulation, because we are promoting circulation towards the heart. So we should follow using a long, firm strokes. Then rinse the skin thoroughly to remove all soaps. Gently pat the skin dry, do not rub vigorously. Bakit? Kasi mas iinit yung skin kung ang patient mo nilalagnat, then nirub mo, mas lalo pa siyang iinit. So gently pat lang, pat dry yung ating skin. And we should always remember that we are always washing from distal to proximal. Okay? Distal to proximal. So this is our distal. Ibig sabihin mula sa pinakamalayo hanggang pinakamalapit. The reason is to promote good blood circulation. Okay? Sa paa din, magsisimula ka muna sa mga fingers sa paa papunta sa legs pag maglilinis ka. So later on, I'll show you how to do that. So we have different types of tub bath. We have the complete bath. So ito yung gagawin natin sa demonstration natin. And we have the partial bath. So complete bath, these are the things that we need. We have the wash basin. Okay, dalawang wash basin ang kailangan natin. One for soap and water. Then the other wash basin is for water only. Okay, then you need soap, bath thermometer. We have the stick or nail file for the nail care. We have the washcloth, 2 bath towels, and 2 hand towels. Okay. So this is the summary of what we're going to do during bed bath. So we should start first from the eyes, okay, from inner to outer canthus, okay. Then we will proceed to the face, to the neck, and to the ears, okay. So after nandun na kayo sa face, gawin nyo na rin yung shaving. Kung ang patient nyo is indicated na mag-shave kayo, especially yung mga lalaking patient, okay, you can do shaving. Okay? So, paano natin ginagawa ang shaving and ano yung mga rules natin on shaving? When we're using electric shavers for persons taking anticoagulant drugs, for those patients na nagtitake like warfarin, aspirin, yun yung mga pampalabnaw ng dugo, hindi tayo pwedeng gumamit ng razors, yung mga disposable razors. We need to use an electric shaver. Bakit? Kasi mas maliit yung mga pang-shave nun. So, mas hindi siya masyadong raised para magkaroon ng cut yung ating patient. Protect bed linens. Sorry. Place a towel under the part under shave. Okay, so para maprotektahan yung linens. Then soften the skin. We can apply a warm, moist washcloth, okay, or towel to face for a few minutes. Okay, ibabad natin siya sa warm water yung towel and then ilagay natin para mas lumambot siya. Then encourage the person to do as much as safely possible. Then you hold the skin taut as needed. Shave in the correct direction. If you're using a safety razor, ibig sabihin ng safety razor, you're using a disposable one, shave in the direction of the hair growth. Shave in the direction of the hair growth. For example, papunta dito yung tubo ng buhok, so papunta pa ganon. Kung yung buhok mo is papunta pa ganon, so pa ganon din ang shave mo. So ganon din, if you're using electric shaver, you use in the direction of the hair growth. So this one, sorry, you should change this because other books they are telling that you should shave against the direction of the hair growth, but we should follow. We should shave in the direction towards the hair growth, not against. Okay, so correct this. You should follow. You should shave towards the direction of the hair growth. If you cut, you found a nick, irritate the skin, okay, nahati nyo, nagkaroon ng bleeding, you put a towel, okay, a clean towel, and then put a pressure so the bleeding will be stopped. Then rinse the body parts thoroughly, apply direct pressure, as I've told you, if you have nicks and cuts, and then report nicks and cuts or irritation to the nurse or your supervisor. Okay, later on, I'll show you how to do the shaving. Okay, so once you finish the shaving or the face itself, okay, you go to the arms, you clean the arms, you start from distal to proximal. You cut the arms into 3 parts, okay, from fingers to elbow, elbow to shoulder, and then shoulder to axilla, okay? So you wash, rinse, and dry. Always follow wash. It means if you're washing, you use soap with water, wash, and then rinse, okay, only water, and then you dry it, okay? So you dry it if it's indicated to use a uh what's this, deodorant, you can use deodorant to your patient, okay? Then you can do nail care at the same time, okay? First is you soak the arms of the patient, okay? You should soak the arms of the patient, but there is one condition which is exempted for the soaking of the arms and foot. So these are the patient who have diabetes mellitus or diabetes. Those patients who have diabetes mellitus, it's not allowed to soak their nails. Why? Because there's a risk of over drying the feet and developing breaks in the skin, which can result to infection. Okay, so if we're doing nail care, these are the things that we need to do, okay? Involves soaking to soften cuticles and layers of horny cells, thoroughly cleaning, drying, and proper nail trimming. So don't soak any nails and foot nails of patients who have diabetes. When providing nail care, the patient remains in bed or sits in a chair. Then in some setting or with a specific patient such as person with diabetes, so healthcare providers order to trim toenails. Sometimes may mga order, kailangan pang i-order ng doktor ang pagka-cut ng nails nila or pag ni-nail care nila, bago ang caregiver ay gawin to. So ganun ka-arte. So yun lang ang gagawin natin for nail care. So if you finish the nail care, okay, you can proceed to the chest of the patient. Then you clean the abdomen. Then you proceed to the legs. So same as the arms, you cut the legs into 3 parts and then you clean from distal to proximal. So from foot to knee and then knee to thigh and then you include the singit, the uh, foot to knee, knee to thigh and then yung tawag doon, yung singit ng patient, inguinal area ng patient. Then, after that, you can soak the patient's foot and then you can do the foot care. Okay? So, pares lang siya ng nail care and foot care. Later, I'll show you. So, pwede mo nang gawin yung foot care. But remember, don't soak the foot of any patients na mayroong diabetes. Then, after that, sa side-lying position mo si patient para malinisan mo yung back niya and then yung buttocks niya. Then, after that, nang nalinisan mo, pwede ka nang mag-back care or back massage. Okay? So, pag natapos mo na, repeat to other sides of the body. Kung tapos ka na sa right arm and then sa right legs, okay, pwede kang pumunta sa kabila and then you can proceed with the other part of the body. So, punta tayo sa back massage. Anong mga gagawin natin sa back massage? Okay, so back care, we have three purposes of back care. We have to enhance relaxation. Okay, anyone who have their we have massage, of course there will be relaxation. Then it will reduce muscle tension and it will stimulate circulation. So there are times that where back care or back massage is not indicated and it's not allowed to use. So for those patients who have fractures in their vertebral column in their back, so it's not allowed. Also, if the patient have rib fractures, if there is burns, especially on the back, open wounds, bleeding, and heart attack. Okay, why are back massage is not allowed to heart attack patient? For those patients who had previous heart attacks, okay, heart attack is caused by there is a blockage of the arteries and veins of the heart, okay? Yung puso mo, meron dong mga arteries and veins na nagsusupply ng blood sa puso mo. Kung yung arteries and veins is nagbara because you have too much comorbidities, you're diabetic, you're not eating healthy foods, or anything which causes heart attack, okay? So, ang mangyayari, mamamatay ang part ng puso mo na hindi nasusuplayan ng blood kasi nga merong blockage, okay? So, kung merong blockage yun, okay, and you massage the patient, okay, pinapalakad mo yung blockage. So, yung blockage na nasa puso mo, pag minasage mo siya, pwedeng mapunta sa ulo na mag-cause ng stroke, pwedeng mapunta sa kidney na mag-cause ng kidney failure, pwedeng mapunta sa liver na mag-cause ng liver failure, and pwedeng magpunta sa lungs which can cause pulmonary embolism. So, yun yung mga pwedeng mangyari if you massage patient na mayroong previous heart attack. So, don't do it. So we have 4 types of back care. We have the effleurage, we have the petrissage, we have the tapotement, and we have the deep friction massage. If we're talking about effleurage, pressure is moved by the hands gliding over the skin. Okay, so you're using your palm. Okay, so later I'll show you how to do this. Petrissage, you're using between the hands and your fingers and thumb. So you're using like this. Then tapotement is your tapping. So tapotement for tapping. Then shearing stresses are created, and deep friction is shearing stresses are created at tissue interfaces below the skin. So these are the back care. These are the types of back care we can use to our patient. Okay. So, tapos ka na sa back care. So, tapos mo na back care ang patient mo. By the way, if we're always doing our back care, guys, before doing back care, we should always ask our patient kung meron to assess yung level ng pain nila. Bakit mo kailangan i-assess? At paano mo i-assess? So, paano mo i-assess ang level of pain ng patient? From 0 to 10, 0 being no pain and 10 being the highest level of pain. Okay, what is your pain scale? Okay, you should ask the patient like this. Then, after the back care, you should also ask again the patient the same question. Okay, so you can evaluate if your massage is effective or not. That's why you're asking or assessing the pain score of the patient. So if you finish the back care, okay, tapos ka na dito sa back care. So tapos na yan. You can go to the perineal care. So, ang perineal care, siya yung pinakahuli sa lahat. Bakit? Kasi siya yung pinakamarumi. So, it involves cleaning the genital and the anal areas. We have 2 purposes of doing the perineal care. We have to prevent the infection and prevention of skin breakdown and odor. So, we are using soap and other cleansing agents, at least 4 washcloths, bath towel, bath blanket, bath thermometer. We have wash basin, waterproof pad, gloves, paper towels. Okay, so we should familiarize ourselves to the part of the perineal area of male and female. So we will know how to clean appropriately clean the perineal area of those patients. So in female, okay, we always remember that the upper layer, uh, which is synonymous to the penis of the male is clitoris. Okay. Then we have the urethra. Urethra, ito yung daanan po ng ihi. Okay? Then yung vagina, dito lumalabas yung ating regla. And then yung bata, pag nanganak kayo. Then we have the anus. So these are the basic openings or the basic parts of the perineal area or female perineal area. So we have also the labia majora. So labia is yung pisngi. Labia minora is this one. Okay? So sa female patient naman, as a male patient naman, I mean, okay? So this is the uncircumcised, yung di patuli, and this is the circumcised one. If we're cleaning the male patient, okay, ito yung mga makikita niyo sa kanya. This is the urethra, daanan ng ihi at daanan ng similia. We have the glans penis. Okay, glans penis, yun yung ulo na tinatawag. We have the shaft. Okay, ang tawag dito shaft o yung body ng penis. Shaft. We have the scrotum. Okay, we have the scrotum. So, ipag naglilinis kayo ng perineal area ng babae, okay, ang una nyong lilinisin, isang stroke na linis dito sa labia majora. Okay? Separate portion of the cloth, hindi pwedeng kung anong pinunas mo dito, yun din ipupunas mo dito. Dapat separate section. So, pag ganon, then pag ganon. Then, after ng labia majora is labia minora. Ang susunod mong lilinisin. Then, one stroke from clitoris, one stroke to the urethra, and then to vagina, and then to the anus. I'll repeat. You will start from labia majora, clean, labia minora, then from clitoris, urethra, one stroke from clitoris, urethra, vagina, and anus. So this is how you will clean the perineal area of the female patient. So if you're doing perineal care of the male patient naman, okay, you should start from the urethra, okay? Urethra, so this is circular motion, okay? Then to the glans penis, then to the shaft of the penis, then to the scrotum, and then under the scrotum, and then the anus. I'll repeat. You'll start with the urethra using circular motion, glans penis, then to the body of the or the shaft of the penis, the scrotum, and then the under the scrotum, and then the anus. Okay? So, in doing perineal care to female patient, we are using the dorsal recumbent position. Okay, what is dorsal recumbent position? It's like supine position, but nakaplex yung mga tuhod. If we're doing perineal care sa male patient, we are using supine position. So, remember that. So, if we have patient, which is, we are encountering patient who has uncircumcised penis, okay? So those patients who are Hindu, those patients who have different cultures, they have uncircumcised penis. So what we will do is we need to retract the foreskin. So the foreskin, or this is the foreskin, or we are calling it as prepuce. We retract it and then we clean this part. Okay? Because maraming naiipon doon na tinatawag nating smegma. Okay? Na yun, pwede natin siyang linisan. Okay, so this is the foreskin or the prepuce. You retract it, so you can clean this part. Okay, so if we're dressing and undressing the patient, if we're undressing the patient, ibig sabihin, tinatanggalan natin ng damit, okay? For those patients na mayroong swero, always remember that the affected part is those part na mayroong swero or mayroong fracture or mayroong weakness or may mga paralysis. So yun yung tinatawag nating bad side or affected side. Okay? Yung tinatawag naman nating unaffected side or good side, yun yung mga walang swero, yun yung mga walang fracture, yun yung mga walang paralysis, walang stroke. Okay? So, lagi lang natin tatandaan, if we're undressing the patient, ibig sabihin tinatanggalan natin ng damit, okay? We should follow undressing for unaffected. We should remove first the unaffected part, okay? Then follow the affected part. Okay? So if we're doing dressing, it will be opposite. Okay? If we're dressing the person, kung binibihisa natin siya, we should start from affected, then to the unaffected. So we should always follow that. So if we're putting the gown of patients with IV or any fracture or any paralysis, we should always provide privacy. Do not expose the person. Encourage the person to do as much as possible. Let the person choose what to wear. Make sure the person chooses the right undergarments. Make sure garments and footwear are the correct size. Okay? Many agencies have gowns and footwear for persons with bariatric needs. Okay? May mga tao kasi na malalaki. So, they need bariatric gowns. Ang tawag sa mga patient na matataba, so that is bariatric. So, we should always remove the clothing from strong or good side or unaffected side, as I've told you. And when we are putting the cloth, we should first put the affected side or the bad side. Then, next is we can change the diaper. If our patient's diaper is soaked with poops, with urine, we should always change the diaper to prevent the patient from having bed sores, skin irritations, excoriations. So proper cleaning techniques will maintain skin integrity and prevent infections, just as prompt and proper disposal of soiled diapers will keep patient environment clean and odor-free. We should consider the following when we're changing diaper. First, observe the facial expression of uncomfortable on the client. Check at least every 2 hours yung diaper ng patient. If our client had passed motion, you should wear the proper PPE, the gloves, the mask, if it's applicable to our patient, with warm water and wet cotton or liquid nappy liner. Okay? Actually, it should be a warm water and then cotton that should be clean, that is used to clean the patient's gluteal area. Okay, not the wipes, because wipes it's having a alcohol that can irritate the patient's skin. So, but if you are so busy, okay, you have a lots of patients, you cannot do that. So wipes is usually used for these patients. So expose the buttocks region till dry before changing into disposable diapers. Observe the color, smell of the urine, and texture of the feces. Of course, any abnormality you saw for the urine and the feces, you should report it to your supervisor. And then you remove gloves and wash your hands. So these are the things included in the complete bath. Okay. So other types of bath is partial bath. As I've told you, it involves bathing of the face, hands, and axilla, back, buttocks, and perineal area, or any area that uh, na gusto lang linisan ni patient. That is partial bath. We have also tub baths for those patient na kaya naman nilang maligo, pero kaya niyong dalhin sila sa banyo, kaya nilang maligo kasi wala silang problema sa kamay, pero sa paa may problem sila. You can bring them by using these items, okay, like this. This is called the uh, commode chair, and we can use as the bath bed shower. Okay, bed shower. So, pwede mong paliguan si patient dyan. Okay, you will transfer the patient there and then pwede siyang maligo dyan nang hindi nababasa yung, ito, kasi pwedeng mabasa, I mean. Kasi nga, water, ano siya, hindi na-absorb yung water. Okay, so, now I will post yung mga videos na panonoodin natin sa sa mga procedure na ito. Thank you.